Hello and welcome to this exploration in finding and uncovering the difference between mental health care providers. I created this PowerPoint for us to have a discussion about the various types of mental health professionals that exist in our modern healthcare system. My name is Matt Gamble. I have a master's in clinical mental health counseling from Southern New Hampshire University. I'm also currently a PhD candidate with Walden University in their counselor education and supervision program. So let's just jump into the different types of mental health care professions that exist. So a psychologist, generally when people think of mental health care providers, psychologist is one that comes to mind. Psychologists are trained to diagnose and treat various mental health conditions using evidence-based therapeutic approaches. They can also administer psychological assessments to evaluate cognitive abilities, personality traits, and emotional functioning. So one thing you'll notice about a lot of the mental health care providers and practitioners that I'll discuss here today is there's going to be a lot of overlap, and that's true with psychologists and some of the other professions that we'll discuss moving forward. It's important to note that a lot of the mental health care professionals can do the same thing that psychologists do. So as a mental health counselor, I can also administer psychological assessments, evaluate cognitive abilities, and emotional functioning. I also am trained to treat and diagnose various mental health conditions. One thing that does differentiate a psychologist from a lot of the other mental health care providers is the evaluation of personality traits, and some assessments. These assessments are broken down into classifications A, B, and C. A Class C assessment anyone can administer. A Class B assessment only a master's level clinician can administer, and a Class A assessment only a PhD can administer. So most psychologists across the country, it's required that you have a PhD, which is a terminal degree in psychology, and a lot of the psychological assessments, like the like personality assessments, are administered by PhD level psychologists. So that's kind of one thing that sets them apart. Moving on, a counselor. Counselors often focus on specific areas such as marriage and family therapy, addiction counseling, career assessment, career counseling, and provide a safe space for clients to discuss their concerns and work towards personal growth and well-being. So counselors do not necessarily spend as much time thinking or using assessments. We will use assessments, but they're not like the large personality assessments that I mentioned previously with psychologists. We will use smaller assessments just to gauge client progress, client growth, usually in areas such as depression and anxiety. We will use those to ensure that what we are doing is benefiting the client. The treatment plan that we've created and come up with the client is actually benefiting what it is that they come to counseling for. Counselors generally hold a master's degree in counseling or a related field. This is generally dependent on from state to state. Master's degree in counseling or a related field. So some states, let's take Kentucky for example, you can have a master's degree in psychology, a master's degree in counseling, social work, and all do the same exact thing and would have the title of a counselor. Here in the state of Virginia, it's required. We have various designations: counselor, social worker. There's just other mental helping professions that you can obtain, but they all require a master's degree. In the state of Virginia, to consider yourself a counselor, you must have a master's degree in counseling. The related fields part goes away for the state of Virginia. That's not applicable. To be considered a psychologist in the state of Virginia, you have to have your PhD in psychology. A master's degree in psychology is of little benefit professionally. And let's see, going forward, social workers. Social workers assist individuals and families in accessing community resources, provide counseling and advocate for clients' rights. Often, social workers work with vulnerable populations and address social issues affecting mental health. Uh, so again, you see that there's a lot of overlap between the social worker, the counselor, and the psychologist. We can all offer counseling services. A lot of us are specialized to work with seriously mental ill clients, vulnerable populations. We all have that ability. It's what sets us apart from one another is our degree and what our degree is in. So my degree, I have a master's degree in counseling because that's what allows me to practice independently in the state of Virginia after certain other requirements are met. Some states, you see, to be considered a social worker, you have to have a bachelor's degree. That's the minimum for some states. It's different state to state, but these professions exist across the country. Other professions, so a psychiatrist. People oftentimes will get psychiatrists and psychologists mixed up. They are very different professions. Psychiatrists are licensed medical doctors who can diagnose mental health disorders, prescribe medications, and provide psychotherapy. They often treat complex cases and work in collaboration with other mental health professionals. So again, you see there's some similarities and overlap. A psychiatrist can, as I've just stated, offer psychotherapy. Psychotherapy is the same thing as therapy, counseling. It's just a different word for going to talk to someone. But a psychiatrist is a medical doctor who specializes in the diagnosis, treatment, and prevention of mental illness. These are people who are going to prescribe you medication for anxiety, depression, what have you. There's a host of things that they can prescribe medications for. Psychiatrists have a medical degree that can be an MD or a DO. So the difference between an MD and a DO, MD just stands for medical doctor. That's a 4-year degree that a person will graduate with from a medical college. DO is a doctor of osteopathy. It is about the same thing as an MD. The only difference really between the MD route and the DO route is the DO route is going to be much more holistic, much more focused on your entire body, whereas the MD is going to be focused more on what symptoms are you walking in the door with. Are you walking in the door with nervousness, anxiousness, things of that nature? The DO is going to be far more interested not only in your nervousness, anxiousness, and anxiety, but what in your life, where in your life is that coming from? That's what the DO is going to be interested in, and that's the difference between the MD and the DO. Both are medical doctors. Both have the exact same ability to prescribe, to treat. DOs can do surgery. There is no difference really in the MD and the DO other than what I've laid out as far as one being symptom oriented, the other being holistically oriented. Family therapists. Now we're getting into some of the breakdown of professions: psychologist, counselor, and social worker. Family therapists work with families as a unit, so the entire family, helping them improve their relationship and resolve conflicts. Family therapists will address issues that impact the entire family and emphasize the importance of healthy communication and understanding. So a counselor, social worker, any of those can be a family therapist. Again, we see this word psychotherapy. That just means individual therapy, but in this instance, it means family therapy. So a family therapist is someone who's going to not work with just one specific person from the family, but they're going to work with the entire family to improve family functioning. Oftentimes, if you've been involved with, say, Department of Social Services, Child Protective Services, they will refer you to a family therapist in order to better improve communication, your ability to get along as a family unit, and to improve family unit functioning. Choosing the right provider. So it's crucial to consider factors such as your individual specific mental health concerns, the type of therapy or treatment that you're looking for, personal preferences. And an example of that would be: are you someone who wants the mental health concern or condition or symptoms treated with medication, or do you prefer non-pharmacological, that's non-medication approaches? It's also important to consider the professional's expertise and experience in the relevant area. So, like I said previously, psychologists, counselors, and social workers, while all having the same or similar capabilities, you will find that some specialize in different areas. And there again, each of these professions can have the same overlap. So I'm a counselor who is specialized in the treatment of LGBTQ individuals, and you would also find that there are social workers, psychologists who also have that same specialization. Occasionally, you'll find a psychiatrist who will choose a specialized population. That's generally not something you're going to see very often. Most psychiatrists are general practitioners, meaning whatever walks in the door, they'll treat or be able to treat. And again, family therapists, you're not going to find very many family therapists who specialize like I am with one particular population. It's important to keep in mind, though, all of the professions have advanced training and education. We are required to have that based on our state, whatever state body is providing us with our licensure. Each can have their own specialization, but not always. And it's very important to consider your individual needs. What are you needing out of your mental health provider? Find someone who is tailored and has the training to provide you what it is that you need. Let's see, a conclusion. Let's see. Okay, so we've already discussed the importance of finding the right mental health care provider. That goes back. Are you someone who wants medication to treat symptoms, or do you want to treat symptoms from a therapy perspective? And that would just be going in, talking to a counselor, a mental health care provider about what it is that's going on in your life. I like to tell people that one of the purposes of therapy is we help people connect the dots. So a lot of people will have a lot of stressors going on at the time of the onset of, say, anxiety, but people don't make that connection. So we help people see with new eyes the stressors that's going on in their life that are having this impact or change of mood, mental health, and we help clear the stressors out or provide with new alternatives or new methods of managing stressors. Not all mental health care providers follow the same mode. You'll find when you start working with a counselor, psychologist, et cetera, that we are required to go over what our modality of treatment is, what our therapy style might be. So as an example, I follow the relational cultural theoretical orientation, and that just means I look at therapy as a relationship, professional relationship between myself and whoever it is I'm working with. There's more to it, but for the purposes of this, we don't need to go in too deep. Also, keep in mind that each will have their own specialty, perhaps not always, but all are competent in common conditions such as anxiety and depression. We can all manage and treat those. You will find there are some counselors who feel uncomfortable treating some of the more serious mental health conditions, such as unstable bipolar disorder. I feel comfortable treating someone who has stable bipolar. Unstable bipolar that's assuming a lot of risk on my part as a clinician. You will also find that there are some of the older school mental health clinicians who will refuse to offer therapy with, say, schizophrenia, schizoaffective disorder, because those are the major psychotic disorders where people are having auditory and visual hallucinations. So the older school mental health professionals will just say, well, what's the use in offering talk therapy to someone who is having psychosis? They're completely detached from reality. What help do you think you can make? There is scant research that talk therapy with psychosis can be beneficial as far as affect regulation is concerned. You don't need to know what that means right now. But so to wrap up, find the right mental health care provider that will best serve your needs. Keep in mind, the types of mental health care professionals I've talked about in this video: psychologists, counselors, social workers, psychiatrists. Figure out what kind of approach you'd like to take. Is it medication, or is it therapy that you would like to attempt? The research also points out that the best results come with a tandem approach of counseling from some professional as well as psychotherapy, as well as medication. So when we combine talk therapy plus medication, we end up with the best results. You can find trained professionals at psychologytoday.com. If you're looking to perhaps pay out of pocket with a sliding scale, openpathcollective.org is a great place to go to and find therapists and counselors, social workers who are offering and have room on their schedule for clients at a sliding scale. You can also go to the federal government website, www.samhsa.gov, find help. If you're in an emergency, you can call the 988 Suicide and Crisis Lifeline. They will also be able to help you find resources that you may need or are looking for. And I hope that this has been beneficial, and thank you for your time, and have a wonderful day.